Okay, next organism we'll talk about is Trichomonas vaginalis. This is not an intestinal infection. Instead, it is urogenital infection. And more often, females are infected with that. Male may be carriers and may cause urethritis occasionally in males, but they're very, very rare among males. But females are carriers, and mild infection may remain asymptomatic. It's a human parasite only, and it is observed that the prostitute and female inmates, prison inmates, may have a very, very high infection rate. And I've had one or two nurses in the class, ex-nurses in the class, and they say they have seen the cases in the STD clinic. Often you will see it in STD clinic. As a matter of fact, even Students' Health Center, somebody I knew working there, and they said they have seen cases of trichomoniasis. It's worldwide. About 5% of normal population may get infection. Now, that's the sort of average or incidence, but very, very high percentage of female prostitutes and inmates, prison inmates, will be infected. Mild infections rarely, are asymptomatic. The mild among the males, I told you that this, if they do get infected, they're asymptomatic. Therefore, there's no need to treat them, or they are not treated. Occasionally, they may suffer mild urethritis or prostatitis. Women, they are often asymptomatic if the infection is mild, or they may have severe vaginitis in heavier inflammation, irritation of vaginal surfaces. One of the features of is copious, foul-smelling, yellow discharge is a characteristic feature of that. Growth of organism favors a high pH, a relatively high pH, above the physiological pH. The normal range of the vaginal environment, normal pH, is around 3.5 to 4.5, around there. And the organisms do not multiply, replicate under those conditions, if one is infected, and therefore the infection does not become symptomatic, And that's an important point, because any douches or treatment that lower the pH are very helpful. You'll see that later. Here's a sort of a non-descriptive picture of the discharge. The organism is not quite like Giardia. It's more rounded, blunt, but it is still pear-shaped. I've got a drawing of it somewhere. If you look at this over here, that's more characteristic feature. It has got unilateral, it's not bilaterally symmetrical like Giardia. And I think a drawing will be probably, here's a more representative, stained slide. There's an undulating membrane, there's the flagellum that traverses towards the posterior. It's attached to the body. It travels almost halfway only to the body. That's further along there. Over here as well, it sort of attaches to the side of the body. And that's referred to as undulating membrane, wavy membrane. Again, the contrast is, of course, unilateral. There's only one nucleus axis and the axis style there. And here's a drawing of it. You can see that flagellum is only up to here. There are no posterior flagellae around here. There are 4 flagellae here. I'm actually Yes, that is Trichomonas vaginalis, and there is a similar organism that's a commensal in the gut. Okay, and therefore, in this, if you were taking just a specimen, not a discharge, by a wipe or some other means, there may be a contamination with this organism, and you can distinguish that from the more rounded, not only more rounded, but most importantly, the flagellum is attached almost to the full length of the body. Okay, so that's the distinguishing feature one has, and that the organism here depicted here is Trichomonas hominis. So hominis is not infective, not symptomatic, not pathogenic, whereas Trichomonas vaginalis is pathogenic. Prevention, personal hygiene, use of condom for just like any other sexually transmitted disease, and treatment is again metronidazole. So as you have seen that iraquinol and metronidazole are almost universal there, except those two opportunistic infections where paromycin was one of them, and TMP was the other one. Okay. All right. Intestinal and urogenital protozoa summary you've got at the end of your handout. There's a summary of it that describes what the which organism produces, what sort of, what is the transmission mode of those organisms, what the symptoms are, major symptoms are, in a non-descriptive style they are presented, and what is the diagnostic material, and what one can see in that diagnostic material, and what the treatment is. And you can, once you have studied, and if you want to review it, you can use that table. Okay? Okay. So that concludes